Kate Brown has announced that she will allow non-urgent medical procedures. Those can resume once again.
But there are still some concerns.
Oregon is in a position where I can lift the executive order delaying non-urgent procedures for our hospitals, clinics, surgery centers, and dental offices.
The governor said the state is on the right path fighting the virus, but not everything can resume immediately. She says there must be adequate PPE and that there isn't a resurgence in COVID-19 cases.
But as Fox 12's Haley Rush explains, not everyone is on board.
Well, since the announcement, we've been receiving nonstop emails from people who work in dental offices. They tell us that they're scared and that this could be putting people at risk. Starting May 1st, non-urgent medical procedures will be able to resume at clinics, hospitals, and dental offices across the state. The plan is to start slow and with caution under new guidelines.
Many Oregonians have been hoping for this news because it means we can now start to think about scheduling that much-needed dental work or medical treatment that you've been waiting for. I personally can say that I am very excited to schedule a dental cleaning appointment very, very soon.
But a handful of dental professionals reached out to us today saying they think this is too soon. We spoke to dental hygienist Marilyn Clulo over the phone. She says aerosols float around the room after procedures.
The aerosol is still going to be lingering in the room for that next patient. And what if that next patient is a senior citizen? What if that next patient is immune compromised?
She also mentioned how they work inches from a patient's mouth.
It's setting things up for a very, very scary situation.
We asked the governor's office about these concerns. They told us to reach out to Oregon Health Authority, but did direct us to OHA's framework for reopening dental offices. In it, it says offices must have adequate PPE on hand and start non-emergency and elective procedures slowly with constant reevaluation.
Then we may need to pause for a bit longer. Sometimes we may even need to take steps back toward more solid ground.
A spokesperson for OHA told us they take risks to all healthcare providers and Oregonians seriously, and that they would, quote, be developing guidance for healthcare providers on how to safely provide care related to the governor's announcement. Many of the dental professionals we spoke with tonight told us they're not sure they'll be able to get that PPE. Last month, they were required to give it away. Reporting live in Southeast Portland, Haley Rush, Fox 12 Oregon.
As for other services, the Oregon Health Authority says it's up to each clinic or office on how to move forward with scheduling.
We are not telling providers exactly what they can or cannot do, but we know that those that are most urgent and necessary are going to be the first on the list.
Providers have to start at 50% of their normal appointment volume. Hospital bed capacity has to stay at or above 20%. While those are some of the rules, some other recommendations include giving masks to patients coming in and not having people wait in common areas such as lobbies.